Please type in.
Thank you. Let me start with the obvious signs of poor mental health. Because one of the things we have said, good mental health is not something you have, it is something you practice. So how do we see that you have poor mental health? It's from what we do, what you do. We observe you, especially if with somebody you have been with, you are going to notice change in behavior, like self-care. The students we teach, one of the main things you see somebody who is not doing well mentally is that they don't take care of themselves. Grooming. You find this student is unkempt. Probably they used to look better, but now even just cleaning themselves, you find this person is not taking a shower, is not dressing in clean clothes. They don't have to be new clothes, but just the clothes you have, they are clean, they are washed, and they are probably ironed. So you will see a poor self-care for this person. Other things you may notice is their eating habits. They have poor eating habits. Sometimes some people overeat, which is also a poor eating habit, because we said you need to be purposeful and intentional about the choices you make. So you find this person, there's just change in the way they eat. So they're either eating too much or they're eating too little. And then the other thing you're going to see is about like sleep patterns. So some people tend to sleep too much, what we call hypersomnia, when they are not well, or they sleep too little, like people who have what we call bipolar mood disorder, and they're in what we call manic state. You realize that they don't sleep at all. Somebody has not slept for over 2 days or 3 days, and they're just overactive. They are pacing up and down. So you may realize this person, even if they are talking, they have what we call pressure of speech. They are talking too fast, too quickly, and maybe they are talking about this and that, so many things which sometimes are not related. So those are some of the things you're going to see. The other major thing you will see is substance use. Use of alcohol, use of drugs of abuse like marijuana are some of the things people do as they try to cope, or smoking. There are some people who now become chain smokers because they are trying to find some peace, or they are abusing prescription medicine. Maybe they are using sleep medicine, they want to sleep, so they're always taking Piriton or taking diazepam or some other cough syrups. They want to sleep. And then the other main thing you're going to see is poor social connections. So everybody will be complaining about this person. Either they are not getting engaged in their family matters, they have neglected their family, they are just not taking care of their responsibilities. If somebody is working, they are not coming to work, or they are coming to work late, and then their productivity at the workplace is low. So general productivity, even if it's somebody who is self-employed, you realize now they are not operating their businesses. So somebody will be saying, this shop is nowadays always closed. When you go, the owner is not there, or it is not well stocked. Things which you usually used to find here, they are not here. So when you see those general changes in the outlook and performance and the person, the general well-being of the person, then one of the main things you need to find out is what could be the problem. The other thing, like when you're talking about social relations, is isolation. These people socially isolate, especially people who are in depression. You find they do not want that stimulation. They don't want to deal with others. And that's why we're saying, especially in this era of COVID-19 and the traumatic period we are in, if you have this neighbor or relative or a friend who is not getting out or is not communicative as much as they used to be, then it's important that you reach out to them. They actually could be suffering from a mental health problem. We've said right now there's quite an increased reports on cases of suicide. Some of the main things you find people are suicidal is they don't interact with others, or when they talk, their talk is negative. They are not optimistic. They don't have that zeal for life. So these are some of the symptoms we need to watch about. People who feel like everything is just hopeless and gloom, and they're keeping to themselves, and then they'll be voicing even in their talk. They are talking about life without them. They are talking, they have given up. You can feel somebody saying there's no point, there's no optimism. One of the main things about human beings who are mentally well is that they're optimistic about their life and their future, and they do things to that effect. So when you engage and find somebody who doesn't think there's anything good about life, they're not feeling good about themselves, and this is voiced out in their words, then it's important that we get concerned and we refer them for help. So I hope with those we can see some of the obvious things to listen out to. So listen to the way people are talking, watch out for their behaviors. They are drinking too much, they are getting into behaviors which were not quite normal or characteristic of them. They are not reaching out more, they are not coming out to interact. Then there is room to be concerned about their mental well-being, because unfortunately such people will not seek help for themselves unless you help them to get help. Most of the people tend to hide and to keep away from the public eye, because also their self-esteem is low. So you need to reach out and get them out of the pit where they have fallen, because that's where mental health or mental illness takes them. As we wait for another question, Dr. Ann, you had talked about social isolation, what I call social isolation. People are interacting, and as they interact, you find they are all on social media. So we need to be concerned, we need to be intentional about this, because this is happening even in families. You may find we are in the family and we think we are spending time, and spending time together is very important. But you find everybody's on their gadget. This one is on this television, the other one is on their phone. So we need to be intentional, because we have said some of us, technology is actually a double-sided sword. It cuts both ways. So we may be all in technology, but we are very alone. We are speaking with the people who are out there. So we need to reach a point where we intentionally say we put down technology, even if it is for 30 minutes, and we say, now can we have face-to-face discussion without having technology in between us. We have seen places where people even text each other when they are just in the same space, because that is the easiest way to get attention from somebody who is just seated next to you looking at their phone. If you're trying to talk to them, they're not looking at you, and they're not going to engage with you. So let us not lose that interpersonal interaction, because it's very important. That's what sets us apart as humans from animals, that we are able to engage, we are able to interact, we are able to have what we call non-verbal communication, just being there for each other, and we are connected. You can look at my eyes and see like I seem like I'm in pain. You can pick that out. But if you're on your mobile phone, you may not be able to pick that. If I type that I'm okay on a mobile phone, you may not see my facial expression and see, but you don't seem okay, or something seems to be the matter. So technology is good, but there's a danger that it can fuel some problems. And we have actually seen people getting addicted to technology. So as people get addicted to chemicals, they are also getting addicted to technology, use of mobile phone and stuff like that. So we also need to be aware about that. I did get the first question, you are a bit broken. So if you can remember, you can remind me exactly what you wanted me to address. Thank you.
Thank you very much. On the charts, I'm seeing Professor is saying the old The old time people believed in God, loved one another, and prayed for mental peace. Today, we take drugs, watch TikTok to find peace, but we have more suicides. But we have more suicides today. Is this old way not any better? I guess he's making a remark. Maybe that's something you can also comment about. And then there's Dr. there who is saying, how can you tell? I want to believe that is can. How can you tell if your leader has mental health issues, both in public and private sector? How would you tell?
Thank you very much. Let me just comment briefly on Professor Josphat's remarks. Yeah, this is a remark. There are some things which held us together as, especially as Africans, and not really as Africans, just as humans, because cultural things, every community and every society has their culture, and some of the things which makes culture, which held people together, was this just common belief, like believe in God, believe in morality in the society and in good of others. And especially in our African culture, this was highly encouraged. And like we said earlier, initially people who had mental illness, they were taken care by the family members. So family members also cared for each other. There was more cohesiveness. We have also said even today, societal and cohesiveness and connectedness is very important. So this is part of what we are saying. Technology and modernity is taking that away from us, because now, like, children are leaving home to go and look for livelihood in cities, in towns, leaving their aged parents at home. Now we are saying sometimes we are even together, but we are further apart because technology has come in between. Use of drugs. Drugs like alcohol were used initially, even in our traditional African societies, but their use was regulated. Right now, the use of drugs is highly unregulated. Anyone can use it, including our young children. So all these exposures are things which were not there initially, and they have brought out different dynamics. Now, the issues about suicide, there's an increasing reports of suicide. So we may say maybe suicide is getting reported more than we used to hear about. Maybe it was just about the same rates, and because there was no social media, there was no technology then, you would not know about suicide which is happening in Mandera or Moyale. But now we get to know when there is suicide somewhere, people even want to take pictures and post. So there's a lot of reported incidences when they happen nowadays. But also people have also gotten more. The society, the population has grown. So as population grows, so other dynamics also grow. There are more people who are likely to be sick. There are more people who are likely to be facing problems. There are more stressors now because we are all fighting for limited space and resources. And all these fuel the things we are seeing nowadays. So the dynamics are different. We may not compare better or not. We're just probably looking at how can we make what we have work for us at this point in time. So that would be just my comment to that discussion. And on how you can tell if your leader has a mental health issue, both in public and private sector. First, we say you can see signs of mental problems, but you cannot diagnose a mental problem just by seeing or watching a person. That person needs to get evaluated. For us, we do not want to stigmatize now. We are coming away from stigma, and because it's from stigma where we also discriminate. So when somebody is behaving with the signs we've talked about, then it's good to help them seek help rather than to label them. So the issue of labeling can only be diagnosed by a medical personnel once they have taken into consideration various aspects, because the presentation of mental health or mental illness is broad. People have different mental health issues which are diagnosable. And actually what research shows that is up to 25% of the population will suffer from a mental illness at some point in their lifetime. So there's a lot of potential or risk for mental illness in the society. There's a lot of undiagnosed mental illness in the society. What we have from the research findings we have now is up to 25%, also 1 in every 4 person who actually goes to hospital is suffering from one mental health illness or another, which they didn't even know about, will be diagnosed when they come to hospital. So there's a lot of mental health problems around which are not diagnosed, which now we encourage people to seek help, because now we have information, we are sensitized, and then we can get the right diagnosis and the right intervention. The areas for intervention now have grown more than we had initially. I can see someone is asking, how can we help people with mental health issues, especially those that have lost help and are no longer optimistic? This one we are saying there is now professional help available. Luckily, we are people who are specialized in mental health, but we can only help you if you come out. So encourage these people to seek help. If they're your family members, kindly help them to seek help, because help is available, but you can only get help when you come out to be helped. The number of people who need help are many. The number of people to provide the help are not as many, but those who come out increase their chances of getting help. So people need not lose hope, because help is available, and we are able to help you when you come out. Thank you. Back to you, Doc.
Okay, thank you very much. There is one in my inbox. Somebody is asking for somebody
Yes.
that has already been on prescription for a mental condition, for somebody that has been on a prescription for a mental condition.
Uh-huh.
How would you comment about the timing when they are supposed to stop the medication? The indication is like they are withdrawal syndrome at the point of stopping the medication. How would they get help so that then they don't have to take the medication for life? Or is the medication meant to be taken throughout their lifetime?
Thank you for that question. What I would say about that, if somebody is on a prescription, that means they have been to a doctor, maybe a psychiatrist, and they have gotten a prescription. So, like for all medicines, you need to follow the directions of the doctor. You do not stop using medication unless you have had that discussion with your doctor, and you have decided together that the doctor has examined you and has seen that you can actually get off the medicine. What we know is medicine used for mental health problems, they are used for the long term, not less than 1 year going to 2 years sometimes. And when you need to stop using the medication, it's because the symptoms you are presenting with have now subsided. And with the doctor, you work on what we call a tapering system. So you do not stop abruptly, because those medications are working on your brain to help your brain to function better. So if you just stop them, then you relapse. You go back to the symptoms you had before you started using the medication. So with the help of your doctor, then you taper off slowly. Meaning, if you are using like 2 tablets a day, your doctor will move you to 1 tablet a day for a certain duration of time. It's a process. And then you probably will move to 1 tablet every other day for another duration of time. Moving like that, and that time they're also observing you to see how your symptoms are behaving, whether they are coming back, they are getting better, or you are symptom free. And that way is the only way. After a period of time, sometimes it goes up to 6 months or 1 year, is when now you can stop using the medication. So someone should not stop using their medication abruptly on their own without consulting with their doctor, or going to a different doctor who does not have your history, has not been treating you, to start tapering off your medication. That is putting the patient in danger. So medical consultation and collaboration is very important. especially in mental health conditions. Thank you.
Thank you very much for that clarification. I hope that is clearly well answered. You can inbox me again to confirm if that is clear. And then there is something else here. Carol is saying most people with mental health issues are in denial and do not willingly agree to be taken to seek help. So how do we help these cases? The doctors rarely accept to go to the patient.
Thank you, Carol. And this I should know better because I run a rehabilitation center, the Fountain of Hope Addiction Treatment and Mental Health Hospital here in Syokimau. And one thing we've seen, and especially people who are in addiction, denial is hallmark of addiction. People rarely agree that they have a problem, and they rarely even agree to seek help. This also happens for people with mental health illness, like people with depression. Now, depression, by its nature, will make the person actually get inside, like the way a tortoise will go into its shell. They get inside themselves, so they are not outward looking, so they are not even likely to seek help for themselves. And this is just the nature of mental illness and addiction problems. So the people who come in handy at this point is actually the support system the patient has, the people around them. If this is your brother, it's your sister, it's your son, it is your relative, then you are their only hope. If you don't come through for them, these people are likely to have advanced outcomes. They actually die out of these problems. And unfortunately, people with mental health problems, we said from the stigma they suffer, from the discrimination, and this stigma sometimes even comes from inside themselves. They rarely seek help, and then they do not get the rightful help they need because they have not sought it, and help will rarely go to them because when we say doctors, they are not even enough. We have very few doctors, and to get one doctor to leave their service, leave their clinic, where probably there's a line of patients waiting to go seek that patient who is outside there, is not easy. It's not easy. So it is the relatives who need to take over and be decisive about seeking help for their loved family member who has a problem. If the relatives and the support system is not decisive, then that is going to be a problem for that patient. We have seen some people, especially when people are employed, the employers play a very important role, and this is why it is important to have this program we call the Employee Assistance Program, so that people can be identified. The people with the symptoms we talked about can be identified and almost be coerced to seek help. Because if they don't seek help, it is make losses for the employer, and it is also losses for the person and the community at large. So someone has to take the responsibility and guide and seek help for the person with mental illness, because mental illness by its nature, people lose their objectivity, they lose their decision making skills, so they do not know that actually seeking help is the best thing for them to do at that particular time. So for you, the person who is not mentally well, you are the one to help them seek help. Thank you.
Thank you very much. I am not seeing someone else that has typed. I don't want to lock out anyone. So if anyone has something they would like to ask, I'm also not seeing anyone that has raised their hand. So in another minute, as I continue making my remarks, if you have a question, you can continue typing it. Dr. Catherine, I really would want to appreciate, because one of the positive challenges you have given us is reminding us that it is us to take responsibility on behalf of the people we live with, either our relatives, our colleagues, our children, or even the students that we lecture and our workmates. That in their space,
sometimes they are not able to take responsibility and they are not able to make decisions that are well informed for them to get help. So I think for me, that will be the positive challenge that I'll carry from this lecture today, appreciating that it is for us to be on the lookout. As we have been reminded, it would be beautiful for us to be able to be our brother's keeper. Projected on the screen are also contacts that we can use to reach Daktari, and the contacts that she has given are very useful for us. You can speak to her directly, like the people that were inboxing me directly. Her number is there. I can also share it in case you are not able to capture it, and that would be very important for us. So that on an ongoing basis, as she said, this is something we practice. It is not something we acquire. It is something we practice. So thinking that we can be able to do this for each other, for ourselves, and for those around us.